we're going to go through a number of different categories of treatment, right? And let's start with the targeted therapy because you're the lead investigator. And so why don't you talk to us a little bit about the BRAF mutation? How does it play playing a role in the advanced melanoma? And what exactly is the targeted therapy?
So the BRAF protein is a member of the MAP kinase pathway. It's part of the signaling from the outside of the cell to the nucleus, and it's one of the main pathways that cells use to signal that it's time to divide. What happens in about 40% of melanoma cells is that one of these components, the BRAF, undergoes a mutation. The most common being in the position of B600. So what that ends up doing is it allows that molecule, the BRAF, to signal downstream by itself instead of what it would normally require is that it form a dimer with another RAF molecule, and that would normally be triggered by an upstream signal from RAS. But if you have in a BRAF V600 cell, that BRAF is signaling by itself as a monomer. It doesn't require upstream signaling. So it continually sends a signal to the melanoma cell to divide. What the drugs that we now have do, these are RAF inhibitors, they actually bind to BRAF, ARAF, CRAF, they bind to wild type RAF, they bind to the BRAF V600 mutant. But the reason that they are specific is because they inhibit monomers. And in a normal cell, monomers don't signal, only in a melanoma cell. So it's wonderfully specific for a mutated BRAF V600 cell. These were the first drugs for melanoma where we actually saw dramatic responses all of a sudden. Never saw that before. So now we expect responses in between 40 to 80% of patients, depending on who you look at.
Yeah, I remember the excitement when that first came out. So just for the folks listening to this, one of the analogy I like to use is that, it's almost like you have an accelerator. Normally requires you sort of step on it for the car to go. And with that mutation and the monomer is almost like this accelerator just always automatically floored to the
it's floored, and it's no longer responsive to the normal feedback mechanisms that would normally tamp down this pathway.